Hi everyone, here is a mnemonic for steroids. These are key things that will help you to remember key facts about steroids. If you can just remember taking steroids, and let's begin to go down the list here. Tendon rupture, T for tendon rupture risk. This is specifically the case when individuals are taking other medications like fluoroquinolones, which are antibiotic class of medications. It does increase the risk for a tendon rupture, specifically in the Achilles tendon. A for adrenal insufficiency. Steroids mimic basically the natural hormone that's made, cortisol, in the body. And so when you take steroids, it kind of takes over for the cortisol for a bit. K. K is the symbol for potassium. And when you take steroids, especially ongoing, it can decrease your potassium. I for immunosuppression. Unfortunately, even though steroids are great for many different things like inflammation is listed here, it also can cause immunosuppression, so you have to be very careful in these individuals who, if they have if there's a suspicion for bacterial infection, you will also see WBC elevation as well, so just to note that. N for no sleep. This can cause insomnia. That's actually very common, and so just you want to let the patient be aware of that. G for gaining weight. It can cause fluid retention, also increase hunger, so a lot of these individuals may notice that after taking it they gain a few pounds. S for skin changes. It can cause atrophy, flushing, and also thinning of the skin. T for taper down. Typically when the individual's on a longer course or a bigger course of the dose of the medication, they need to taper down slowly. If they stop abruptly, a lot of times they can have withdrawal symptoms, which can be fatigue, severe weakness, nausea, vomiting. You will see short bursts, but they're usually smaller dose and also just that short burst for a short period of time. E for elevated blood pressure and heart rate. You have to be very, very careful in individuals who have hypertension and also individuals who have any kind of arrhythmias in their history. R, rooster crow. The easiest way to remember rooster crow, you think roosters crow in the morning, so just make sure to take this in the morning, especially with food. It can cause severe stomach upset, so you want to be very careful to take with food. And also there are some studies that show that there's less effect on related to adrenal insufficiency if taken in the morning. O for osteoporosis. More specifically, if this is a long-term low-dose medication that's being used in certain patients, especially with autoimmune diseases, this can change bone density, increase your risk for osteoporosis, and just bone thinning in general. I for irritability and mood changes. Individuals who have any kind of mood disorders, you have to be very careful because this can cause some mania, irritability. Also, I guess a good thing about it is it also can increase energy as well. So that's something, I guess, a good thing that you could say as far as a side effect. D, diabetes. If the individual has diabetes, you want them to be very cautious about taking this. That you may want them to check their glucose more often because it can increase their sugars, and so that's something to note. And S for swelling in the extremities. This is due to fluid retention. You want to be very careful in individuals who have CHF or congestive heart failure, because this can actually lead them into a CHF exacerbation. Well, hopefully that helps. And I guess one other thing that's not on here, I could have mentioned up on the skin, is that it can impair, if there's a bacterial infection or wound healing, it can impair that wound healing.